Ano ba tong nangyayari sa buhok ko? Parang lagas ng lagas. At panipis pa siya ng panipis.
These are some of the most common complaints we hear from our patients during consultation. So, kailan nga ba normal or hindi na normal ang mga symptoms na ito? Let's find out in Hair Transplant PH. Good day everyone! Thanks for joining us in our second hair transplant vlog. Again, before we forget, if you, a family member or a friend, is experiencing some hair loss problems or talagang interesado lang kayo sa topic na ito, don't forget to click and like the subscribe button below. There are many symptoms associated with hair disorders, but for this vlog, let's talk about the most common ones and when to seek consult with your doctor. So the first common complaint would be hair shedding or yung paglalagas ng buhok. Normally, our hair undergoes hair cycle. Anagen is the growing phase of the hair, while catagen is the resting phase and telogen is the shedding phase, after which the hair enters the anagen phase again. Ito ay normal na nangyayari sa ating buhok araw-araw. At kung pag-uusapan itong araw na ito, 80 to 90% ng ating buhok ay in the growing phase, while 10 to 15% of our hairs would be in the resting phase. Ito yung normal. So we have more or less 100,000 strands of hair in our scalp, and losing 100 strands of hair in a day would be considered normal. So this is what we call physiologic hair loss, and you don't need to be worried about it. So we can observe it. If any of these stages are triggered to fast forward to the shedding phase, then your hair sheds rapidly. Common triggers would be stress, dietary and hormonal imbalance, micronutrient deficiency, medical illnesses, inflammatory states, and aging. So kapag ganito ang sitwasyon, you need to go to your dermatologist. So during consult, we need to know your history and we might do some blood tests and we'll do physical examination to check your hair. So usually, our common diagnosis would be telogen effluvium, alopecia areata, or androgenetic alopecia. Problem number 2, hair thinning. For this, patients come to us with complaints that their scalp is already more visible than before. Napapansin din nila na kakaunti na lang ang buhok na natatali nila into a ponytail. This could be an end result of chronic hair fall and related to the previous conditions mentioned in hair shedding. It would be advisable to visit your physician so that you can be guided on what to do. Number 3, receding hairline. Naku, sobrang common din ang complaint na ito. Obserbahan ninyo ng mabuti kasi most of the time, patients with this complaint follow a certain pattern of hair loss. Most men will follow the Norwood-Hamilton scale of hair loss, wherein prominent features are recession of the frontal hairline, deepening of the temporal angles, appearance of a crown, or loss of hair from the front all the way to the back. Females, on the other hand, follow the Ludwig scale of hair loss wherein hindi naman talaga umaatras ang hairline pero numinipis and nagwa-widen ang tuktok ng ating buhok. Receding or pattern hairline is commonly found in androgenetic alopecia. And for this one, takbo na agad uli sa inyong dermatologist so you can be advised on what to do. Number 4, bald spots over smooth skin. Madami ding patients ang nagsasuffer dito. They can be localized, generalized, and there is even a condition wherein there is a total hair loss in the scalp and body. Patients may be given a diagnosis of alopecia areata, frontal fibrosing alopecia, and for this, it is recommended to consult your dermatologist for proper diagnosis and management. Last on our list of common hair concerns would be bald spots, pero this time over-inflamed skin or broken tufts of hair. Patients with this condition usually present with a long history of itching, scratching, or pulling of hair. This could be due to infectious disorders, autoimmune conditions, or psychological concerns. Kaya for this condition, consult again with your dermatologist. Ang daming hair concerns, no? And for each specific problem, meron namang management na pwedeng gawin.
So alin sa mga problems na ito ang pwedeng magamot ng ating hair transplant procedure? Let's all find out in our next vlog as we talk about indications for hair transplantation.
See you in our next episode, and remember, we are always here for you.